Rashid, take one.
My name is Abbas Rashid. I'm a consultant elbow and shoulder surgeon. I work at the Hospital of St. John and St. Elizabeth. My drive and focus is something that I've always had. I think it was instilled in me by my parents. My background is that my parents were East African Asian immigrants to the UK that came over in the late 60s, early 70s. And like a lot of people that came from sub-Saharan Africa, they came to the UK with very little. And education was huge. My father was a dentist, my mother was a seamstress. And so there were two different things. First of all, from my mother's side, there was a lot of instilling of values of artistry, hand-eye coordination, spatial awareness, and so on. My father, much more science-based and linear in his thought process, more abstract thought and linear thought coming together. And pushing us towards careers in medicine. So myself and my sister, we both ended up going down the route of medicine. And I suppose that's why we ended up as surgeons. I think it was the ability to combine the artistry of something with the application of sciences in a real world way. My first foray into the medical world was the work experience I did as a student at secondary school with Professor Walker at the Department of Bioengineering at the Royal National Orthopaedic Hospital. I think that sparked my interest, and I spent that time shadowing him, machinists who were actually manually using instruments like lathes to make bespoke implants. And then I also was lucky enough to go in with the orthopedic surgeons and watch them implant these prostheses in patients. So it was watching the journey from start to finish. I was fortunate enough to get a place at Imperial College School of Medicine. After my first couple of years, I found that UCL was offering a Bachelor of Science degree in Orthopaedics. And so I asked my tutors if I could intercalate over at UCL for a year, and I was very fortunate enough in that they said yes. And so I went off and did the Bachelor of Science degree in Orthopaedics at UCL in 1 year, and then came back to Imperial College and I picked up my clinical studies. And so my higher surgical training all happened in Northwest London. Once I finished my higher surgical training, I went on to do UK and international-based fellowships, and was fortunate enough to win a couple of awards to go traveling and visit surgeons overseas. Orthopaedics appealed to me for a variety of different reasons. I think, firstly, I encounter patients from all sorts of ages and backgrounds. I don't just deal with one isolated group of patients. I deal with everyone from children to the elderly. I deal with people who have very cold issues like osteoarthritis and rotator cuff issues, degenerative problems. But I also deal with trauma, I deal with sports injuries, and I also deal with cancers of bone as well. And it's fascinating, it's interesting. It keeps me on my toes all the time. I'm not just dealing with the same thing over and over again. And there's a tangible result at the end, and you can see that. And so the satisfaction associated with seeing someone who's really disabled by a problem and you helping them with it and making them better, there is no better job satisfaction than that.